Hematology Test 2. 1. In the hemoglobin solubility test dithionate, hemoglobin S causes turbidity or positive reaction. Anemia of chronic disease is the most common cause of anemia in hospitalized patients. Heinz bodies are denatured hemoglobin inclusions that are readily removed by the spleen. Cells for the transport of oxygen and carbon dioxide are erythrocytes. Myelofibrosis is the disease where teardrop cells and abnormal platelets are most characteristically seen. Evidence indicates that the genetic defect in thalassemia usually results in a quantitative deficiency in RNA, resulting in decreased globin chain production. Hemoglobin C disease has bar-shaped crystals. The most appropriate screening test for hemoglobin S is dithionate solubility. Hemoglobin SC has weird-shaped crystals. Howell Jolly bodies are made of DNA. A characteristic morphologic feature in hemoglobin C disease is target cells. Evidence of active red cell regeneration may be indicated on a blood smear by basophilic stippling, nucleated red blood cells, and polychromasia. Hemoglobin C is the hemoglobinopathy that's associated with rod-shaped crystals. Chronic blood loss is most closely associated with iron deficiency anemia. In the normal adult, the spleen acts as a site for removal of imperfect and aging cells. Cabot rings represent residual nuclear fragments. Pappenheimer bodies are red blood cell inclusions that are seen in sideroblastic anemia and contain high amounts of iron. The characteristic morphologic feature in folic acid deficiency is macrocytosis. Hemoglobin times 10 divided by the red blood cell count is the formula for calculating the mean corpuscular hemoglobin, or MCH. MCHC is hemoglobin times 100 over hematocrit. The characteristic morphologic feature in lead poisoning is basophilic stippling. Red cell membrane defects is the characteristic most common to hereditary spherocytosis, hereditary elliptocytosis, hereditary stomatocytosis, and paroxysmal nocturnal hemoglobinuria. Hypersegmentation is the white cell feature that is most characteristic of pernicious anemia. MCH is the indice that measures the amount of hemoglobin in individual red blood cells. Prussian blue stain can be used to differentiate siderotic granules from basophilic stippling.